What if the treatment promising to make you look younger left you with visible pulling, less facial volume, or a result that disappeared before you finished paying for it? Every year, patients spend thousands of dollars on procedures described as quick, gentle, and almost risk-free. The word non-surgical makes them sound harmless. But non-surgical does not mean consequence-free, and new technology does not automatically mean better medicine. I'm Dr. James Carter. Today we're examining several cosmetic trends that became popular before most patients fully understood their limits. Some of these procedures can have a legitimate role in carefully selected people. The problem begins when a treatment designed to create a small improvement is marketed as a substitute for something it cannot anatomically accomplish. Throughout this video, we will look beyond polished before and after photographs and examine what these treatments actually do beneath the skin. More importantly, you will learn which questions to ask before spending your money or making a decision that may be difficult to reverse. Thread lifts are a perfect example. The idea is easy to understand. Barbed sutures are placed beneath the skin and pulled upward, creating an immediate lifting effect without the incisions or recovery associated with facelift surgery. For someone worried about downtime, that promise can be extremely persuasive. Imagine a woman named Laura Bennett preparing for her daughter's wedding. She notices early sagging along her jawline and chooses a thread lift because she expects a fast, lasting transformation. Immediately afterward, her face appears tighter, although there is swelling and some bunching of the skin. Over the following weeks, the swelling settles and the irregularities soften. Unfortunately, much of the dramatic lift she first noticed also begins to fade. That does not mean every thread lift fails. In an appropriately selected person with mild to moderate laxity, it may create a subtle, temporary improvement. But it cannot reposition deeper facial structures in the same way as surgery, and it should never be presented as an equal replacement for a facelift. Depending on the patient and technique, possible problems include persistent pain, infection, visible or extruding threads, asymmetry, puckering, and an unfavorable result. The most important question is not whether a procedure can produce any change. Almost every cosmetic treatment can produce some change. The real question is whether the size and duration of that change justify the cost, risk, and expectations being created. Thread lifts reveal the first rule of aesthetic medicine. A temporary pull should not be confused with structural restoration. But the next category raises an even more troubling possibility. What if a treatment meant to tighten your face damages the very volume that helps keep it looking young? That question brings us to energy-based treatments, a category that includes radiofrequency, focused ultrasound, and combinations of heat with microneedling. These devices are frequently promoted with words such as lifting, tightening, contouring, and rejuvenation. Those words often appear together, but they do not describe the same biological change. To understand the difference, picture facial aging in separate layers. The skin can become rough, sun-damaged, creepy, or less elastic. Beneath it, fat compartments can lose volume or shift position. Deeper tissues can also descend, changing the cheeks, jawline, and neck. A treatment that improves collagen in the skin does not necessarily lift structures that have moved at a deeper level. Used appropriately, an energy device may improve texture or create a modest degree of firmness. A younger patient with early laxity may be satisfied with that subtle result. The danger comes when a limited skin treatment is sold as a non-surgical facelift to someone with significant structural descent. That patient may undergo several expensive sessions and still see little change in the shape of the face. Depth and heat also matter. Facial fat is not simply an unwanted layer. In the right locations, it creates smooth transitions, supports youthful contours, and prevents the face from appearing hollow. If energy reaches unintended tissue or creates excessive thermal injury, unwanted fat loss can leave the cheeks or temples looking more depleted. In October 2025, the United States Food and Drug Administration issued a safety communication after receiving reports of serious complications associated with certain uses of radiofrequency microneedling. Reported problems included burns, scarring, fat loss, nerve damage, disfigurement, and, in some cases, the need for medical or surgical treatment. This does not mean RF microneedling has no valid use. In trained hands, with an appropriate device and carefully selected settings, it may be considered for concerns such as acne scarring, wrinkles, or skin texture. But it is a medical procedure, not an at-home beauty treatment, and no single depth can be declared universally safe for every device, facial area, and patient. Before agreeing to treatment, ask for the exact name of the device, what tissue level the provider intends to target, what realistic improvement you should expect, and how complications would be managed. If the answer is simply that the machine will lift everything, that is not an anatomical explanation. So far, we have seen one approach that tries to pull tissue upward and another that tries to tighten it with energy. When neither creates the transformation a patient wants, the next suggestion is often to add volume. And that is where the so-called liquid facelift can become either a precise correction or a very expensive disguise. And that brings us to the liquid facelift, a name that suggests filler can reproduce the effect of surgery without an operation. Filler can be an excellent tool when the problem is genuinely a localized loss of volume. A small amount placed with precision may soften a hollow, restore balance, or refresh the face without making it look treated. The problem begins when volume is used to camouflage significant sagging. If the cheeks, jawline, and lower face have descended, adding several syringes does not return those tissues to their former position. It may make the face fuller, but fullness and youth are not the same thing. In some patients, repeated injections create heaviness or an overfilled appearance while the original laxity remains visible. There is also a safety issue that deserves respect. The most serious filler complication is accidental injection into a blood vessel. Although uncommon, it can interrupt circulation and lead to tissue death, visual impairment, blindness, or stroke. This is why filler should be treated as a medical procedure performed by a qualified professional who understands facial anatomy and has a plan for emergencies. Now consider the opposite trend, buccal fat removal. Instead of adding volume, this operation removes a naturally occurring fat pad from the lower cheek to create a slimmer, more sculpted face. Imagine Emily Hayes at age 28. She has always disliked her round cheeks and likes the sharp, hollow look she sees online. Soon after surgery, her cheekbones appear more defined, and she is pleased. But a photograph taken shortly after healing cannot predict how that choice will look 15 years later. The face naturally changes with age. Fat compartments may shrink, descend, or become less evenly distributed. Removing cheek fat permanently from someone whose face is already narrow can make future hollowing more noticeable. This does not mean buccal fat removal is wrong for everyone. A person with persistently full cheeks, stable weight, suitable anatomy, and realistic expectations may be an appropriate candidate, but it should not be performed simply to follow a temporary fashion. Possible surgical risks include asymmetry, infection, persistent pain, injury to a salivary duct or facial nerve branch, and an unsatisfactory aesthetic result. More importantly, the operation subtracts tissue that cannot simply be placed back exactly as it was. The lesson is not that volume should always be added or always preserved. It is that both addition and subtraction require a diagnosis. Filler should not be used to disguise major laxity, and permanent fat removal should not be chosen without considering how the face may age. That principle becomes even more important when surgeons move from the cheeks to the deeper structures of the neck, where an aggressively sculpted result may look impressive at first but unnatural over time. The neck is one of the first areas where many people notice aging. A softer jawline, loose skin, muscle bands, or fullness beneath the chin can change the entire profile. Because the neck is difficult to hide, patients are often drawn to dramatic before and after photographs showing an extremely sharp angle under the jaw. But sharper is not always younger. A well-planned neck lift may address loose skin, excess fat, and visible muscle banding. In selected patients, it can create a meaningful and natural improvement. Aggressive neck sculpting goes further. It may involve removing larger amounts of fat from different tissue planes and altering deeper structures in pursuit of the most defined possible contour. The concern is not that deeper work is automatically inappropriate. Some patients genuinely require treatment beneath the surface to correct their anatomy. The concern is removing more tissue than the patient needs simply because an exaggerated result performs well on social media. A youthful neck is not an empty neck. Natural softness helps the skin move smoothly over the muscles and creates a gentle transition between the jaw and throat. If too much supporting tissue is removed, the result may appear hollow, irregular, or skeletonized. Areas that looked sharply defined during early recovery can become less flattering as swelling disappears and the face continues to lose volume with age. Imagine Michael Turner, a fictional patient who asks for the sharpest jawline possible. He selects photographs of much younger models and requests the same angle. A responsible consultation should not begin by choosing how much tissue can be removed. It should begin by determining which features come from fat, skin laxity, muscle position, bone structure, or simply normal anatomy. Those problems do not all require the same operation. Neck surgery also carries genuine medical risks, including bleeding, infection, fluid collection, prolonged swelling, changes in sensation, skin irregularities, poor healing, and rare nerve injury. A dramatic cosmetic goal does not cancel those risks. This is why permanent subtraction deserves a higher standard of decision-making. Ask the surgeon which structures will be treated, why each step is necessary, what the neck is expected to look like after swelling has resolved, and how the result may change over the next decade. A natural outcome should restore proportion rather than advertise the operation. The best rejuvenation often looks as if the clock moved backward, not as if the patient received an entirely different neck. So far, the permanent changes we have discussed were deliberately created with injections or surgery. But the next treatment introduces a different kind of concern. Sometimes a device designed to reduce fat produces only a modest improvement, and in rare cases, the treated area may become larger instead. That unexpected increase is known as paradoxical adipose hyperplasia, and it is associated with cryolipolysis, commonly called fat freezing. The best-known commercial example is CoolSculpting. The appeal is obvious. A device is placed over a pocket of unwanted fat. Controlled cooling damages some fat cells, and the body gradually clears them. There are no surgical incisions, and many patients return to normal activities quickly. But body contouring is not weight loss, and fat freezing should not be presented as liposuction without surgery. Earlier in my career, I watched clinics invest heavily in this technology after seeing impressive marketing and hearing enthusiastic recommendations. The expectation was that patients would receive a dependable, visible reduction without an operation. What became clear over time was that results varied. Some patients noticed a worthwhile change. Others completed several sessions, spent a considerable amount of money, and struggled to see a meaningful difference. More common effects can include temporary redness, tenderness, numbness, bruising, or swelling. Surface irregularity and asymmetry are also possible, and some patients may simply fail to achieve the result they expected. That gap between a medically measurable change and a patient's idea of transformation matters. A modest reduction may be acceptable when expectations are modest. It becomes disappointing when someone has been led to expect a newly sculpted abdomen or a surgical-level result. Then there is paradoxical adipose hyperplasia. Instead of becoming smaller, the treated area gradually becomes larger, firmer, and sometimes more clearly defined in the shape of the applicator. It may appear months after treatment when the patient expected continued improvement. The enlarged tissue generally does not behave like ordinary temporary swelling, and correction may require liposuction or another surgical procedure. This complication is considered uncommon, but rarity does not make it irrelevant. Before an elective treatment, patients deserve to understand not only the most likely outcome, but also the uncommon outcomes that could be difficult or expensive to correct. Cryolipolysis can still be reasonable for a properly selected person with a small, localized fat bulge and realistic expectations. The consultation should explain how much improvement is likely, how many sessions may be needed, what alternatives exist, and what the clinic will do if the result is uneven or the treated area enlarges. The lesson is not that every non-surgical device is a mistake. It is that convenience can make people underestimate uncertainty. A treatment may require less recovery while still carrying biological consequences. And this leads to a larger question. How do procedures move from promising technology to widespread treatment before their long-term value is fully understood? The answer often begins when marketing travels faster than evidence. One of the clearest examples of marketing moving faster than evidence has been the promotion of energy-based devices for so-called vaginal rejuvenation. This is a sensitive subject, and it deserves more precision than the advertisements often provide. Women may seek help for dryness, discomfort during intimacy, urinary symptoms, changes after childbirth, or concerns related to menopause. These are real medical issues, but they do not all share one cause, and they should not automatically receive the same treatment. Laser and radiofrequency devices were promoted with broad promises of tightening tissue, restoring function, improving comfort, and renewing confidence. In some clinics, the procedure was offered as a quick add-on, rather than as part of a careful gynecological evaluation. That should immediately raise a question. Has the patient's condition actually been diagnosed, or has a device been selected before the problem is understood? Evidence in this area is more nuanced than either enthusiastic advertising or blanket rejection suggests. Some short-term studies and specialist guidance have described potential benefits for selected patients. At the same time, serious adverse events have been reported, and important questions remain about long-term safety, durability, ideal treatment settings, and which patients are most likely to benefit. Symptoms such as burning, pain, dryness, abnormal bleeding, discharge, or painful intercourse can have many explanations. These may include hormonal changes, infection, inflammatory skin conditions, pelvic floor dysfunction, previous surgery, or other medical problems. Applying energy without first excluding those causes can delay appropriate treatment or expose sensitive tissue to unnecessary risk. A qualified gynecologist or urogynecologist should evaluate persistent symptoms and discuss established options as well as newer procedures. Patients should ask whether the proposed use is supported by good evidence, what alternatives are available, what side effects have been reported, and how long any expected benefit is likely to last. This example reveals the common life cycle of a cosmetic trend. A genuine concern creates demand. A new device offers an appealing solution. Early success stories spread rapidly. Before and after images replace detailed evidence. The treatment expands beyond the patients originally studied, and only later do its limitations become widely discussed. Innovation is not the enemy. Medicine advances because clinicians test new ideas, but responsible innovation requires honest consent, appropriate training, careful patient selection, and the willingness to change direction when stronger evidence appears. We have now examined procedures that pull, heat, fill, remove, freeze, and reshape tissue. In the final part, I want to give you a practical 5-question test that can help you evaluate almost any cosmetic treatment before you spend your money or place your health in someone else's hands. Before choosing any cosmetic treatment, begin by identifying the problem you are actually trying to solve. Facial aging does not happen in one single layer. The first category is skin quality. This includes sun damage, uneven pigmentation, fine surface lines, rough texture, and reduced elasticity. Skincare, sun protection, chemical treatments, and certain carefully selected devices may improve these concerns. The second category is volume. Some areas become hollow or lose smooth transitions with age. Precise filler or fat transfer may help an appropriately selected patient, but adding volume everywhere can create heaviness rather than youth. The third category is structural descent. This occurs when deeper tissues shift downward and the shape of the cheeks, jawline, or neck changes. A surface treatment may improve the skin covering those structures, but it cannot be assumed to reposition them. Once you know which category is responsible, use this 5-question test. First, what exact anatomical problem is this treatment supposed to correct? If the explanation consists only of words like rejuvenation or tightening, ask for greater detail. Second, was this procedure or device designed and studied for that specific purpose? A machine that improves texture should not quietly become a substitute for every other form of treatment. Third, what result is realistic for someone with your age, anatomy, medical history, and degree of aging? Do not rely only on a clinic's best photographs. Ask how typical those results are and when the pictures were taken. Fourth, what can go wrong, and who will care for you if it does? A trustworthy provider should be willing to discuss common side effects, uncommon serious complications, recovery, and the possibility that you may not be satisfied. Fifth, what happens if you wait? Cosmetic decisions are rarely emergencies. Taking time to seek another opinion, compare alternatives, or allow more evidence to emerge can protect you from a permanent decision made under temporary pressure. Being cautious does not mean rejecting innovation. New technology can improve medicine, but enthusiasm should never replace diagnosis, anatomy, or informed consent. Choose a qualified professional who is prepared to tell you that a procedure is not right for you. even when saying no means losing a sale. And remember that no treatment stops aging. Healthy skin habits, consistent sun protection, realistic expectations, and conservative decisions continue to matter whether or not you ever choose a procedure. The goal should not be to chase a different face every time a new trend appears. It should be to preserve your identity, correct the right problem, and choose an outcome that will still look natural years from now. I'm Dr. James Carter. If this conversation helped you think differently about cosmetic treatments, subscribe to the channel and share this video with someone considering a procedure. And if you have personal experience with one of these treatments, tell us what changed, how long the result lasted, and what you wish you had known before making your decision.